Did you know that your mouth is not just where digestion begins? It's also where some of the most dangerous diseases can quietly take root. That's right. Poor oral hygiene doesn't just lead to bad breath or tooth loss. It can lead to something far more serious, including oral cancer. In this video, we'll explore how to clean your mouth properly every day to dramatically lower your risk of oral cancer and other dangerous conditions. This is not just about brushing your teeth. This is about protecting your health, your voice, your smile, and your life. Let's dive in. Chapter 1. The link between oral hygiene and cancer. When we think about oral hygiene, we often associate it with fresh breath, white teeth, and a confident smile. However, what many people don't realize is that poor oral hygiene can also have serious consequences far beyond the mouth, including an increased risk of cancer. Recent studies have shown a strong link between chronic gum disease, also known as periodontitis, and several types of cancer, such as oral cancer, throat cancer, pancreatic cancer, and even esophageal cancer. When oral hygiene is neglected, harmful bacteria build up in the mouth, leading to inflammation and infection of the gums. Over time, this persistent inflammation doesn't just stay local, it can spread through the bloodstream and affect other parts of the body. Chronic inflammation is known to be a key factor in the development of cancer, as it can damage healthy cells and tissues, weakening the body's ability to defend against abnormal cell growth. For older adults, this risk is even more significant because the immune system naturally weakens with age, making it harder to fight off infections and control inflammation. Maintaining good oral hygiene, brushing your teeth twice a day, flossing regularly, visiting the dentist for routine checkups, and avoiding tobacco is not just about dental care, but about protecting your entire body. A healthy mouth may help lower your cancer risk, improve your quality of life, and even extend your lifespan. So the next time you brush your teeth, remember, you're not just caring for your smile, you're also safeguarding your health. Chapter 2. Brushing the right way. Every day, brushing your teeth, it's something you've done your whole life. A habit so routine, it often goes unnoticed. But here's something most people don't realize. Brushing the right way, every day, could help protect you from serious health issues, including cancer. Let's start with the basics. Use a soft bristled toothbrush. Hard bristles can wear down your enamel and injure your gums, especially over time. Hold the brush at a 45-degree angle toward your gum line. This allows the bristles to clean both the tooth and the gum edge, where plaque tends to build up. Use small, circular motions. Forget the harsh scrubbing. Gentle is more effective and much safer for your teeth and gums. Brush for 2 full minutes, twice a day. Once in the morning, and once before bed. It may sound like a lot, but 2 minutes goes by faster than you think, and it's worth every second. Don't forget the hard-to-reach areas. That means the back teeth, the chewing surfaces, and especially along the gum line. These are the spots where bacteria love to hide, and where problems often begin. And here's something people often skip: your tongue. It may not seem important, but the tongue can trap bacteria, contributing to bad breath, chronic inflammation, and yes, even increasing your cancer risk over time. A gentle brush or a tongue scraper each morning can make a big difference. By brushing the right way, you're not just taking care of your smile, you're caring for your whole body. Studies show that gum disease and oral inflammation are linked to serious conditions like heart disease, diabetes, and even certain types of cancer. So this simple routine, done the right way, becomes a powerful tool for disease prevention. For older adults, proper oral hygiene becomes even more important. As we age, our gums may recede, and saliva production may decrease, increasing the risk of cavities, infection, and inflammation. But with the right technique, you can protect your mouth and your health for years to come. Chapter 3. Flossing, your secret weapon against gum disease. Brushing your teeth is important, No question about it. But if you're skipping flossing, you're missing out on one of the most powerful tools for protecting your oral and overall oral health. Here's the truth. Your toothbrush can't reach the tight spaces between your teeth. That's where plaque and food particles build up, and if they're left there, they harden into tartar, irritate your gums, and spark the early stages of gum disease. Flossing removes plaque where your toothbrush can't. It reduces inflammation, and it helps prevent bleeding gums, infection, and bone loss around your teeth. And for older adults, flossing is even more essential. As we age, our gums naturally recede. This exposes more of the tooth, creating deeper pockets where bacteria can settle and thrive. Without flossing, these areas go untreated and silently begin to damage your gum tissue and bone. The good news, flossing doesn't have to be complicated. You can choose traditional string floss, floss picks, or even water flossers, whatever works best for your hands and comfort. The key is to be gentle and consistent. Here's how to do it right. Use about 18 inches of floss and wind it around your fingers. Gently guide the floss between your teeth using a sawing motion. Never snap it. Curve the floss into a C shape against the side of each tooth and slide it up and down. Be sure to reach just below the gum line. That's where harmful bacteria love to hide. Make flossing part of your daily routine. Once a day is all it takes. Try doing it before bedtime, after brushing. It only takes a few minutes, but the impact is lasting. Gum disease doesn't just cause bad breath or loose teeth. It's been linked to more serious health conditions, like heart disease, stroke, diabetes, and even certain types of cancer. That's why flossing isn't just about dental care. It's about total body health. Daily flossing tips. Be gentle. Use the right tools for you. Floss once a day. Don't skip the back teeth. Make it a habit. Flossing may seem like a small act, but it's your secret weapon in the fight against gum disease. It protects your gums, strengthens your teeth, and supports your long-term health. So take the time, grab the floss and make this simple habit part of your everyday life. Chapter 4. Mouthwash, the final protective step. You've brushed your teeth, and you've flossed between them. But there's still one last step that makes a world of difference in your oral health: mouthwash. While brushing and flossing are crucial, mouthwash is the final protective layer that ensures your mouth stays fresh, clean, and free from harmful bacteria. Mouthwash is more than just a quick fix for bad breath. It's an essential tool for maintaining overall oral health, helping to kill bacteria, reduce plaque, and protect against gum disease and cavities. By using mouthwash, you're giving your mouth a thorough, all-around clean that brushing and flossing alone can't achieve. But to get the most benefit, it's important to use mouthwash correctly. First, pour the recommended amount of mouthwash into the cap, typically about 20 milliliters. Swish the mouthwash in your mouth for 30 seconds, making sure to reach every corner of your mouth, including the back of your throat and under your tongue. It's not just about getting rid of bad breath. It's about preventing gum disease, reducing plaque, and even fighting cavities by targeting bacteria that might be left behind after brushing and flossing. Choose the right mouthwash for your needs. There are many types of mouthwash on the market, but they're not all the same. Look for one with antibacterial properties that can help reduce plaque and fight bacteria. If you have sensitive gums or teeth, consider alcohol-free mouthwash to avoid irritation. Some mouthwashes also contain fluoride, which helps protect against cavities, making them a great addition to your oral care routine. For older adults, mouthwash is especially important. As we age, our immune systems weaken, and our mouths may produce less saliva. This can lead to dry mouth, a condition where there's not enough moisture to wash away food particles and bacteria. Mouthwash can help by keeping your mouth moist and creating a barrier against harmful bacteria. But mouthwash isn't just for your teeth and gums. It can also help prevent oral infections, soothe canker sores, and even reduce inflammation from dental procedures. For those who wear dentures or braces, mouthwash is an extra layer of protection that helps cleanse hard-to-reach areas, preventing bacteria from causing irritation or infection. The key benefit of mouthwash: it neutralizes the harmful bacteria that contribute to gum disease, cavities, and bad breath. By reducing bacteria in your mouth, you're protecting not only your teeth and gums, but also your overall health. Mouthwash tips for optimal results: use after brushing and flossing. Swish for at least 30 seconds. Choose the right mouthwash for your needs. Look for antibacterial or fluoride options. Use alcohol-free if you have sensitive gums. Make it a part of your daily routine. Chapter 5: Hidden Habits That Sabotage Your Mouth. Even with great brushing habits, certain behaviors can still damage your mouth. Smoking or chewing tobacco. These are the biggest risk factors for oral cancer. Excessive alcohol use, especially when combined with tobacco. Dry mouth. Saliva is your natural defense. Without it, bacteria thrive. Neglecting dentures or dental appliances. These must be cleaned daily. Replace harmful habits with protective ones. Drink water frequently. Chew sugar-free gum to stimulate saliva. Clean dentures thoroughly every night. Limit sugar and processed foods. Chapter 6: How Diet Affects Oral Health and Cancer Risk. What you eat doesn't just affect your waistline, it also impacts your oral health and, surprisingly, your cancer risk. Diets high in sugar, acidic drinks, and processed foods feed the bacteria in your mouth. These bacteria produce acids that wear down your enamel, inflame your gums, and create a perfect environment for chronic disease, including oral cancers. Chronic inflammation in your mouth, especially from untreated gum disease, has been linked to increased cancer risk, not just in the mouth, but throughout the body. But the good news is, your diet can also protect you. Fruits and vegetables are rich in antioxidants that help reduce inflammation. Fiber-rich foods clean your teeth naturally, and drinking plenty of water helps wash away food particles and keeps your mouth hydrated. By making simple changes, like cutting back on sugar, avoiding tobacco and alcohol, and eating more fresh, whole foods, you're not just protecting your smile, you're lowering your cancer risk and investing in lifelong health. Chapter 7: The Importance of Regular Dental Checkups. You brush, you floss, you rinse, but even with the best at-home routine, there's one more step that's essential for lifelong oral health: regular dental checkups. Dental checkups aren't just about clean teeth, they're about early detection and prevention. Your dentist can spot problems you might not feel or see. Tiny cavities, gum inflammation, early signs of oral cancer. Plaque can harden into tartar in places your toothbrush can't reach, and once it's there, only a professional cleaning can remove it. Left untreated, it can lead to gum disease, bone loss, and even tooth loss. For older adults, regular checkups are even more important. As we age, our risk for gum disease and oral cancer increases. A quick screening during a routine visit can literally save your life. Think of dental visits as maintenance for your mouth and your overall oral health. Every 6 months, give your smile the care it deserves. Because prevention is always easier and cheaper than treatment. Chapter 8: Signs of Oral Cancer You Should Never Ignore. Oral cancer may start silently, with no pain, no bleeding, and no clear cause. But behind the silence, it can grow quickly and become life-threatening if not caught early. That's why it's so important to recognize the early warning signs. 1. Persistent mouth sores. A sore in your mouth that doesn't heal after 2 weeks is a red flag. It may look like a canker sore or a patch of irritation, but if it sticks around, it's time to see your dentist. 2. Red or white patches. Patches of red, white, or mixed colors on your tongue, gums, or inside your cheeks could indicate abnormal cell growth. These patches often feel smooth or velvety and may be painless. Don't ignore them. 3. Difficulty chewing, swallowing, or speaking, struggling to move your jaw, tongue, or having pain when swallowing. These can be signs of a deeper issue in your mouth or throat that needs medical attention. 4. Lumps or thickened areas. If you notice a lump in your cheek, tongue, or neck, especially one that doesn't go away, it may signal something more serious. Oral cancer often spreads to nearby lymph nodes, so swelling in your jaw or neck is a key symptom to watch. 5. Loose teeth or jaw pain without dental cause. Oral cancer can weaken the bone structure and tissues around your teeth. If your teeth become loose or your bite changes without a clear dental reason, get it checked. 6. Hoarseness, numbness, or tingling. Changes in your voice, numbness in your lips or tongue, or tingling sensations should never be brushed off. They could mean nerve involvement, a possible sign of cancer spreading. These symptoms don't always mean cancer, but ignoring them could mean missing the chance to catch it early, when treatment is most successful. During your regular dental checkups, your dentist performs an oral cancer screening, a fast, painless procedure that checks for suspicious areas in your mouth, tongue, and throat. Make those visits every 6 months, or sooner if you notice anything unusual. When it comes to oral cancer, early detection saves lives. You deserve to enjoy life without fear, and that starts with staying informed and taking action. Trust your instincts. If something feels off in your mouth, don't wait. Get it checked, stay safe, and protect your health. Chapter 9. Creating your daily oral health routine. Let's put it all together. Morning. Brush teeth and tongue. Use mouthwash. Drink a glass of water. Evening. Floss. Brush again. Use mouthwash. Clean dentures if applicable. Bonus. Eat a healthy, low-sugar diet. Avoid tobacco and alcohol. Hydrate all day long. These 10 minutes a day could add years to your life. Oral health isn't just about smiles. It's about survival. Every time you brush, floss, rinse, and protect your mouth, you're not just cleaning, you're defending your future. Because a clean mouth is a healthy mouth, and a healthy mouth may help you live longer, stronger, and cancer-free. So start today, because you're worth it.